morning, everyone. The topic of my presentation is determination of prevalence and predictive factors of diabetic retinopathy in a tertiary healthcare center in India. My name is Dr. Shravani Sarkar. There are no financial conflicts of interest to disclose. Introduction: diabetic retinopathy is a sight-threatening complication of diabetes and a major cause of visual impairment. It is the fifth leading cause of blindness globally. Close to 1 million people are blind due to diabetic retinopathy. The burden of diabetes in India is rising exponentially and is expected to reach the numbers of 134 million by 2045. Understanding the prevalence and the associated risk factors is therefore strongly needed to screen patients for diabetic retinopathy and follow them up so that early intervention can be done. Method in this study: we did a prospective cross-sectional study carried out between March 2022 to August 2022. All patients diagnosed with diabetes mellitus seeking treatment in our hospital during the study period were considered eligible. Data was collected from medical records, examination, and using a semi-structured questionnaire. Univariable and multivariable logistic regression analysis were done to identify predictors of diabetic retinopathy using SAS 9.4 software. Coming to results, 181 patients with known history of diabetes were enrolled in the study. There were 112 males and 69 females in the total sample. The mean age was 56.8 plus and minus 12.2 years, ranging between 22 to 87 years. The mean and the median duration of diabetes was 7.14 years and 6.2 years respectively, and ranging between less than 1 year to more than 25 years. There were 35.4% out of, there were 64 patients diagnosed with diabetes retinopathy constituting about 35.4% of the total patients. Out of that, 61% were males and 40% were females. Coming to results section, the age, we divided them into more than 60 years and less than 60 years. More than 60 years, even though it was 1.03% of increased odds, but it was not statistically significant. Male patients were showed a little bit more increased odds, 1.95 times compared to females in the univariable regression analysis. However, in multivariable regression analysis, after adjusting for other variables, it was not statistically significant. Coming to duration of diabetes, those patients with more than 10 years of diabetes had were 3.5 times more likely to develop diabetic retinopathy, which was consistently present even in multivariable regression analysis. Insulin intake, patients were on, those who were on insulin were 4.87 times more likely to develop diabetic retinopathy. That was consistent even with multivariable regression analysis. We also looked at compliance of hypoglycemic medications, and those patients who were not compliant were actually more at risk of developing diabetic retinopathy. Coming to hypertension, with patients with history of hypertension were 3.7 times more likely to develop diabetic retinopathy, and patients with systolic blood pressure of greater than 140 mm of mercury were 3.39 times more likely to develop diabetic retinopathy. And patients with hemoglobin HbA1c more than 7% were 2.06 times more likely to develop diabetic retinopathy. Coming to discussion sector, the prevalence in our study was about 35.4%, which was higher than two of the other studies that found a prevalence of diabetic retinopathy around 14 to 15%. One factor could be because it was a hospital-based study, and other two studies were a community-based study. A lot of patients diagnosed with diabetes are aggressively referred to our department for screening of diabetic retinopathy. And also our center provides anti-VEGF injections free of cost. That's another reason for more patients with history of diabetic retinopathy getting referred to our center. These two reasons, I think, could be a reason for higher prevalence of diabetic retinopathy in our center. Other than that, systemic blood pressure of more than 140, duration of diabetes, insulin intake, and HbA1c, and poor compliance of hypoglycemic medications and history of hypertension continue to show as independently associated with diabetes retinopathy. And identification of risk factors in diabetic retinopathy is important for education of patients and counseling, so that modifiable risk factors can be controlled, and also to diagnose diabetic retinopathy at early stages. Some of the limitations of our study was sample size consisted of hospital patients, and it was not taken from the community, and relatively smaller sample size. This conclusion, I would say that with rise of diabetes prevalence, diabetes retinopathy is expected to rise.